Exclusive government emails reveal that the Public Health Agency of Canada, led by Theresa Tam, conducted medical experiments on innocent Inuit babies without their parents, or their community's informed consent to do so. These secret trials tested expensive pharmaceutical drugs in a failed program, all while ignoring ethical standards and operating with zero accountability. Today's report is a bombshell, and it's definitely not one that you will hear from the mainstream media. This information has been hidden for years, buried under government secrecy in the depths of Chief Public Health Officer of Canada, Theresa Tam's emails, which are slowly being trickled out after an access to information request by Brett Sears was made public on X. Due to the breadth of the response spanning 450,000 pages of Theresa Tam's emails, this is going to be released in phases, and Brett took to X to call for help in dissecting the response to ensure that no stone goes unturned. So in today's report, I'm going to feature the work of former Toronto police detective, now retired but turned independent investigator, Donald Best, who dissected some of these documents and discovered that secret medical experiments are still being conducted on Indigenous children. And the person at the heart of all of this? Well, none other than Theresa Tam. The uncovered documents reveal the government secretly subjected Inuit children to an experimental RSV monoclonal antibody program, which ultimately failed to deliver any results. RSV is a respiratory viral infection that's typically mild, like the common cold, but can lead to more serious lung and respiratory issues, especially in individuals with underlying health conditions and the young. But the experimental drug program was conducted on Inuit babies without informed consent or parental consent at all, and unbeknownst to the larger Inuit population, exposing the government's approach to supposed public health, not only on Indigenous communities, but this lack of transparency and willingness to conduct unethical experiments on Indigenous communities to this day. And as we've seen throughout the COVID era, also on all Canadians more broadly. Now, the documents show that Tam and other public health bureaucrats knew about the ethical concerns with this particular experiment, but they did nothing. It involves a monoclonal antibody injection made by AstraZeneca called palivizumab, which I will acronym PVZ. In a December 16th, 2019 email to Tam and others, Dr. Tom Wong, who's the Director General of the Office of Population and Public Health at Indigenous Services Canada, acknowledges that the experiment failed. It reads, contrary to what was expected, the impact of the Nunavik PVZ program on RSV hospitalizations in healthy full-term Nunavik babies less than 3 months during 3 RSV seasons evaluated so far is disappointing. Part of the key results from the evaluation included a shocking admission of ethical concerns. Some ethical concerns were raised by healthcare workers regarding the guarantee of a free and informed consent from parents or caregivers. It reads, as well as the absence of involvement of Inuit population in the decision and implementation process. This is unbelievable. This was nothing short of a deeply unethical and appalling experiment on vulnerable babies, exploiting those who were most at risk for a drug that Health Canada acknowledges on its very own recommendations webpage is an expensive product. More key concerns include the fact that prior to which is the Public Health Agency of Canada's evaluation, no data was available on the effectiveness of this drug in healthy full-term babies. This gets right to the heart of it. It exposes the truth. This was a deliberately orchestrated and coordinated experiment designed to mine data and study outcomes without any regard for the well-being of those involved. And it was all for naught. The agency confirms there is little chance that PVZ protected against RSV hospitalizations since the point estimate of PVZ effectiveness was negative. They go on to reinforce even further that it failed to prevent not only regional in 2 Nunavik hospitals, but also tertiary, pointing to evacuations to the south, RSV hospitalizations. This email confirms that the Public Health Agency, Tam, Wong et al. Knew that the entire experiment was pointless and that the data even showed a negative effectiveness, with the drug failing to prevent hospitalizations both at regional hospitals in Nunavik and during excavations to the south. Donald Best's article goes on to highlight troubling historical precedents where non-consenting Indigenous children were subjected to unethical and inhumane secret experiments throughout the 1930s, 40s, and 50s and onwards, ranging from tuberculosis vaccine trials where 1 in 5 children died, apparently due to diseases of poverty, to deliberate starvation in the 40s and 50s in the name of studying malnutrition, atrocities that clearly persist in various forms to this day. As a former detective, Best poses a $1 million question. If these emails reveal that Dr. Tam and other officials knew about the dangers of these injections, these drugs, coupled with evolving evidence and science around the novel modified RNA shots, and still push them onto the public despite the risks and a lack of informed consent, could this lead to criminal charges? It's a real possibility, which Best says could be criminal negligence causing harm and more. Now, this email exposes a deeply disturbing pattern of unethical medical experimentation on vulnerable Indigenous children at the hands of Canada's public health agency. What's even more appalling is the absolute disregard for informed consent, transparency, and the well-being of these children, which should be the cornerstone of public health initiatives. Despite the government's acknowledgement of the failures and ethical concerns surrounding these experiments, they proceeded without accountability and even go so far as to recommend PVZ for infants and young children with health conditions based on the thought that it may prevent 40 to 80% of hospitalizations. These are deliberate actions that withhold crucial information necessary for true informed consent. Public health exploited and manipulated innocent babies in vulnerable communities to benefit big pharma and promote expensive products. I put that stinging accusation to Health Canada, which oversees the Public Health Agency of Canada, asking them how they respond to that grave accusation. No one responded. What's at stake here is not just the health and safety of Indigenous children, but the very integrity of Canada's health authorities and their commitment to ethical standards, if at all. If history has taught us anything, it's that the truth has a way of emerging, no matter how hard it is to swallow and how long it takes. But how far do these unethical practices go, and who, if anyone, will be held responsible? For Rebel News, I'm Tamara Ugolini. To support this kind of work and find out more about the novel modified mRNA injections, please head over to nomoreshots.ca. That's nomoreshots.ca.